So if I have a man come in, it's not so much the initial number that I'm looking at, is I'm trying to treat his symptoms. Now, the endocrine societies, as you know, and other societies will tell you that if those levels are normal, that we should look for other causes of those symptoms. So if they come in and they're fatigued and they, are too tired to do anything, what's the first thing they're going to get is an antidepressant. If they can't sleep, they're going to get something to help them sleep. If they can't get an erection, they're going to get, something to help them get an erection. We're going to treat all those symptoms without really getting to the cause. And the reason is we're trained to treat a lab value. We've turned into a lab-centric medical society versus a patient-centric. We used to treat patient and their symptoms. Now we treat a lab value. And if that lab value is normal, we do not consider other diagnoses. We just treat symptoms. Something that we're not taught about. We have no training. You didn't have any training. I didn't have any training. Nobody that's in medical school right now, residency, or is getting any training in hormone replacement therapy. And my personal opinion on that is it's politics and economics. Medicine is a business. Hormone optimization is all about preventive medicine. It's about preventing disease and maintaining health. Medicine, the medical community that we're in, we depend on people being sick and needing surgeries. I mean, as well as I do, if you've been in a hospital, worked around a hospital, that when those beds start getting empty, those people panic. When the surgery centers are not full of surgery, the surgery centers panic. We need sick people. We need to treat, we're trained to treat diseases with medications or surgeries. We're trained by the pharmaceutical companies. And that's just the way medicine is. We as physicians are trained to diagnose and treat disease, not prevent disease. If everyone were healthy, the whole system would implode. And that's just the truth. I want the listeners to understand that medicine is big business. Your biggest lobbying group here in the US is the pharmaceutical industry.